Hello, welcome to another post from Dr. Blake's Healing Soul. Today, Aphrodite, our athletic trainer here at St. Francis Hospital, will go over some of the common components of a fall prevention program.
Okay, so the first thing you want to do is if you're concerned about falling or if you've had a history of falling, it's important to come in to get a physical therapy assessment. So the physical therapist will get a history of the patient's injuries, when they fall, what they can do to prevent injury or falling. So the assessment includes anywhere from getting range of motion, um, testing muscle strength to see where there's weakness and where there can be improvement, um, making sure that they are tested functionally. So have the patient come up, tell them to start from one end of the hallway, walk to the end, come back, just to see what's out of alignment. If there's a postural issue, like if the patient is hunched over, we want to make sure that we work on all the postural muscles to, make sure they're nice and tall. And if, let's say, the history implies that they fall more when they're walking in the street, then I can ask them, what type of shoes do you wear? Do you walk a lot of hills? Is it more flat ground? That sort of thing. And then there are various ways to help with walking. So if I assess the patient's gait and I see that they can't go from this end of the room to the other end, there are various things that you can do to help with that, such as walking sticks. So I'll have the patient, when they do the walking sticks, they always go with the opposite leg. So as the right one comes forward, their left leg comes forward, and then opposite. And make sure that the whole time they have really good posture, not leaning forward like this. So I tell them, pretend there's a string from the top of your head going straight up towards the ceiling, just to make sure that they're nice and tall. A lot of times they'll have to work on their core strengthening because everything stems from the core. So if your core is really weak, it's really hard to maintain that good posture. So kind of like this. And you don't have to bring the stick too far forward. You want to emphasize more baby steps, and as the patient gets more functional and stronger, you can increase the stride a little bit more each time. You can also use a walker, crutches. I try to avoid using a cane or one crutch because the patient can often develop other problems from leaning to one side, such as lower back problems. So usually I have them use something that comes in a pair, so walking sticks or crutches or a walker. It's more stable, you can use both hands. And as far as, let's say they don't have enough range of motion in their foot, I'll have them do things like alphabet, like going through A, B, C, to the whole alphabet to gain that range of motion back. I'll have them work on single leg balance. You want to strengthen the glute medius doing the single leg balance. Especially if they have a discrepancy in the actual gait pattern, you want to make sure that you strengthen the core, the glutes, basically the whole lower leg. And again, just go from the root of the problem. So if they have an issue going from sitting to standing, you want to work on actually coming to a chair and making sure they get in it correctly. So instead of flopping down, reach back, make sure they're nice and stable going down to the edge of the chair, scooting back, same to get up to the edge, and really take their time and use the correct muscles to get up and down.
Great. Well, thank you very much, Aphrodite, for explaining that.